gives you a different picture. We can see the cartilage a little better, and you can also see some of the soft tissue a little better. Now, we also do what's called an MRA, actually. An MRA is we inject dye into the hip, and once the dye is injected, we then do an MRI, provide a better relief, contrast relief of the materials, of the surrounding materials in the hip.
Okay. When is arthroscopic surgery not an option, and are there alternatives? Typical surgery.
Once there's a significant amount of arthritis, that's when arthroscopic surgery. It's a little late. The cat's out of the bag at that point, and it's not going to be of any long-term benefit, and it's not certainly something that I would advocate. These other alternatives after that are different types of hip replacements, of course, for this type of surgery. There's the surface replacements, and then there's the full hip replacement.
What happens in arthritis that's probably not a good idea? It probably won't get the same result. What has happened to the hip?
Once the cartilage is broken down, that's the smooth, articulating, near frictionless surface that we have in our joints. Once that has broken down past a certain point, that's when this scope won't really help you.
Okay. Does that typically break down due to age, or is that a wear and tear issue?
It can be both. I mean, if you're younger but have had more wear and tear, then your hip may look like somebody who's not had as much wear and tear and they're older. Mm-hmm. So it's just a combination of those two things.
Okay. If you were having old-fashioned surgery with the big cut versus the arthroscopy, first of all, is arthroscopy the choice for most people today?
For most people today, it is. I would say there are some centers that still do the open surgery, and that's definitely an okay thing to do.
Result is the same, you were saying?
Correct.
Okay.
And about more than 90% of the things that you need to address inside of a hip can be done with the scope, and you would know ahead of time whether or not those 10% or less than 10% of the time, whether or not you wouldn't be able to do that with the scope. So you wouldn't be going into the scope and not being able to do something. It would be, you would know ahead of time, and you wouldn't do the scope. Okay. If that makes sense.
What sort of, and you said you've actually gone into surgeries ready to go the other route because you weren't sure, right? You said just fairly recently that happened.
Just fairly recently, we had some very interesting case where we had some anchors inside the hip joint that was done somewhere else that we had to sort of get out of there, and so we went in there with the scope and tried to get them out. And if we were not going to be able to reach these with the scope, then we were prepared to do it open. We were able to get them out with the scope.
One of the advantages is the recuperating time, I would think, on the arthroscopy versus the larger incision. But what sort of physical therapy follows arthroscopic surgery?
Typically, you'll be walking, get therapy the next day, and so you're walking the next day. You'll be on crutches, moving with not putting all your weight down on the leg for 2 weeks if we do some bony work. Now, if we don't do any bony work, you can put your full weight on it right away. But if we're doing bony work, you will be walking with crutches for 2 weeks, and then you'll be running at 6 weeks, and on the elliptical and the Stairmaster at about 4 weeks.
What is the pain like for those first 2 weeks?
Pain is for the first, well, I inject some local anesthetic right into the hip, and that lasts for about 10 to 20 hours, somewhere in there. So it's pretty good. And then typically most patients go home the same day, unless they're coming in from far away. All my patients that come from far away, we'll keep them overnight in the hospital because we don't want them driving home. The pain for the first 2-3 days is moderate. I mean, it's not terrible, and if it somehow is terrible, we keep them in the hospital, of course. But it's mild to moderate. It gets better. Typically, the first 2-3 days are the worst, and then it gets progressively significantly better. I had a patient come in just on Wednesday of last week, 2 weeks out of surgery, no pain, 100% gone.
Wow. If there is a trend in medicine, it is to get us back on our feet faster. And that's just not to get us back to work or back to our regular lives, but it seems to me that doctors have come to the conclusion that, the old days, any kind of surgery, you'd either sit in the hospital for a couple of days and then go home and not do anything for a couple of days. The recovery process was slower. Let's sort of ease back into it. But now it seems, whether it's open heart surgery or arthroscopic hip surgery, it's getting us back on our feet and getting the movement going faster. Is that what you're seeing? And if so, explain that to our viewers and patients, why that's the case.
Well, these days, if you're, for example, fixing a bone, fixing a fracture, you don't want that joint to be stiff. if you're doing arthroscopic hip surgery, you don't want that joint to develop stiffness over time. You want to get it moving as quickly as possible to avoid any of that, and that's what this minimally invasive technique helps to do. It avoids any of the morbidity of a big incision and a big incision having to heal.
Our guest has been Dr. Misty Suri. We thank you for the education and the information you provided, and most of all, we thank you for sticking around. Since you grew up here, went to school here, we are glad you're still part of our city and contributing in the way you are. Thank you very much.
Great to be back. Thanks, Del.
Yes, thank you, Dr. Misty Suri. Well, as we mentioned earlier, the Hello Health seminars take place almost every week across our area, and here's a look at what's coming up. On Tuesday, July 7th, Dr. Brandon Hyder will talk about dealing with stress in today's challenging economy. That's at Chateau Country Club. On Thursday, July 9th, gastroenterologist Teddy Winstead will be at Ralph's on the Park to discuss inflammatory bowel disease, its causes, and its treatments. And on Monday, July 20th, Dr. Stuart Busby, a neurologist, will discuss obstructive sleep apnea. Vascular surgeon Britt Tonneson will be here with me on LAE to bring us the latest information about carotid artery disease. That'll be live from 8 to 9 p.m. here on LAE. Now, to register for any of these seminars or to make an appointment with any Ochsner physician, including Dr. Suri, our guest tonight, you can call Ochsner at 504-842-5669. That's 504-842-5669. That's a special number established just for this program. You can rewatch tonight's presentation or any of our Hello Health programs on our website, WLAE.com, so you can share it with a friend. Just go to Watch Local Shows on Demand and click the Hello Health button. You can also see many of our programs on Ochsner's website. This is a partnership, after all, at ochsner.org. Just type Hello Health in the search area. Our thanks again to tonight's guest, Dr. Misty Suri, orthopedic surgeon, to Ochsner and Humana for making this program possible. And as always, our final thanks is reserved for you, for your support of this program, Hello Health, and our station, LAE. Television worth watching.
Hello Health on LAE has been presented by the Ochsner Health System. 600 physicians in 80 medical specialties working with a team of more than 10,000 employees to provide nationally recognized healthcare across Southeast Louisiana. Ochsner, healthcare with peace of mind.
I call it my I've got a healthier plan. With the Humana Medicare Advantage Health Plan, I get more health and wellness options like fitness programs, health management classes, and a 24-hour nurse line. I can even talk with a Humana Market Point representative whenever I need to.
More of what you want, because you deserve more.